All right, we're back here in the living room, and today we're talking about the Utah Pain Center. And I'm here with a nurse practitioner, Mandy Johnson.
Correct.
And you are a technician, and you brought a patient here, but let's talk about what goes on at the Utah Pain Center.
Great. I'm a nurse practitioner, and this is Jenny. And Jenny came into the office with severe low back pain and also pain in her right leg. To begin, we did an examination, reviewed her MRIs to come up with a diagnosis to decide where we needed to begin treating first. We started with some laser treatment and also some spinal decompression treatment. Initially, Jenny's pain was also so severe she wasn't able to sleep at night.
And is that the definition of chronic pain? How bad was it for you, Jenny?
It was pretty bad. I had it all through November and December, and then at the end of December it just got so bad I couldn't handle anymore.
So now, before you came to the Utah Pain Center, what were you doing to try to manage that pain?
I was just I'm very active, and I was just doing my tennis, my yoga, and all the things that I do. And then one morning I got out of bed and I couldn't even step on my right leg, and I was bent over in two. And a girlfriend called and she said, "Why don't you go to the pain center, go to Dr. Lundington, give him a call." And I called him and he said, "I'll see you the morning after New Year's." So I went out to his office that morning.
And how is the pain now?
I'm pretty much pain-free now.
So Dr. Ludington, let's talk about this. What is chronic pain? And does it just happen in the lower back?
No, it can happen in a lot of places, and chronic means that it's going to be been there for a while. Maybe it flares up and back and down, and that's what's happened with Jenny, was that she's had some flare-ups. This was the worst flare-up she'd ever had, and it wasn't backing down. And so we started working on figuring out what was wrong, what keeps going out, what keeps causing this trouble, and then see what we can do to improve it. And we had a couple different therapies to use that way.
All right, let's talk about your different therapies and treatments. What other treatments do you have at the Utah Pain Center?
We do have a light therapy. It's called laser therapy or light force laser therapy. There's different brands of laser, and that's one we have. It's a very powerful laser. And it reduces the pain the person's going to feel almost immediately, and more importantly, speed up the healing process. So if it's an injury, something that can be improved, it's going to improve very fast. And we also use decompression therapy because she had a disc injury, and we needed to do something to improve that disc tissue. And between those two and some gentle joint manipulation added in there, and then eventually getting into more of the therapy of home exercises, stretching and core strengthening, we're able to get it to under control and get it to a situation where now all she needs to do is her home exercises to keep feeling as well as she does.